Hey there, Dr. Alan Christianson here, and I'm sitting in the lap of luxury in my new perch. I've got nothing hurting my butt, and I'm good to go. So let's talk about food allergies. So we all know they're a big deal. We all know they can be common, that they can be hidden. But what I want to talk about is, are you stuck with them? Do you have to have them long term? And why is that important? Well, they're stressful. Let's be frank about this. You should be able to live your life amongst people and in the world and not have to be constantly fearful about the things you ingest. So let's think about ways in which perhaps they could reduce. And for starters, I want to make some distinctions. There are some types that, as of yet, we don't think can improve, and those are the more anaphylactic allergies. So that's the real sad cases of bite of peanuts makes it where you can't breathe, or piece of shrimp in the soup covers you with a rash. So those we don't want to really risk. So this is not what I'm referring to in the pending discussion. Ooh, I've got a big piece of cactus. Ooh, right on my leg. Hold on. Ouch. Okay, now I'm pain-free again. This is the Sonoran Desert, the realities of it. So not the peanut anaphylaxis, not the shellfish things, and also not celiac. So that's an autoimmune state that you've got to avoid long-term, no way around it. But everything else, we're going to talk about everything else. One closing comment, though, on the anaphylactic ones. A few things we've learned about that lately. Kids that have more foods at earlier ages have fewer anaphylactic reactions. So if you've got little kids or grandkids, encourage them to have a wider range of things, especially peanuts. The more kids have peanuts at an early age, like really around the age of weaning, like in their first solid foods, the lower their risks are of getting peanut reactions later on. And we've seen cultures that have kids eat the most of them earliest have the lowest rates of the reactions. And the reactions have gone up radically at the same time frame that parents have gotten more restrictive of foods for kids for longer periods of time. You know, in my profession, I think we've been guilty of this. We've had these very elaborate food reintroduction schedules. And the intent behind them was to prevent food reactions, and they would do that by having the kids have very few foods until much later along, and not have exposure to dairy, eggs, nuts, common allergens until they were much, much older. Well, now we know that was exactly backwards. That was the wrong way to go about it. That the more exposure you have early in life, the less stuff you are reactive to later in a severe way. There's also some really encouraging data about desensitizing for anaphylactic food reactions. It's not yet fit for consumption. It's still in some beta testing, but it's looking really encouraging. So stay tuned. I'm watching that closely. So along the same lines, the more foods you can have, the less apt you are to get reactive to more things, the same way it worked out with kids. So I'd love to have it to where within a variety of just healthy, natural, good foods, you could eat freely and not be stressed about that. So here's a process. Here's an idea. The first thing you want to do is get really good clarity on the things that are affecting you badly. And how do you want to go about doing that? Well, some things hit you in the moment, and some things creep up on you over time, and you want to make sense out of both. So the ones that clearly affect you in the moment, that's real. That's solid data. And here's a trick, though. Sometimes you can feel like you're having a reaction to a food when it really was not. So we have a lot of symptoms that come and go and are not significant and not meaningful, and it can be very easy to misattribute a random symptom to something you just ate. So for a short-term reaction to be real, it's got to be pretty consistent, meaning that whenever you have that food, it affects you in that way. So if it seems random or fleeting or inconsistent, that may not be important. That may be something else. So the ones that are more delayed and hidden. Now, one way to gauge that is by the avoidance and reintroduction diets. So you eat no food for 2 weeks, but maybe like lamb or rice, or maybe like a few simple things. Then you phase foods back in one at a time. It's been a gold standard for quite a while, but it's falling out of favor. And here's why. When you restrict your diet, you restrict your digestive capacity. The fewer foods you do eat, the fewer foods you can digest. You know, it's the old use it or lose it principle. So you lose your digestive resiliency the more narrow your diet gets. And you can have very real reactions to foods after an elimination diet that you would not have in normal circumstances. So we now know a lot of the very real symptoms, we would call those false positives. We would call those reactions that are not important or not ones that would occur in everyday life. So not a fan of the avoidance reintroduction, because you can make yourself nuts and end up eating nothing. So checking and testing is good, but it's very different from method to method and lab to lab. So you want to test and know what the delayed reactions really could be for you. I'm going to try to go glasses free here and not squint. There's tests that are based upon your blood. There's skin tests, and there's electrodermal tests, where you have devices that measure currents throughout your body. The skin tests are reasonable but not great for airborne allergies. They're not accurate for dietary allergies. They miss the delayed ones. The blood tests are good. They're horribly variable from lab to lab. So I'm not tied to any labs. The two that I've seen give the same data on the same person on a divided blood sample would be US Biotech and Meridian Valley Labs. They're very good. They're actually some of the lower cost ones as well, which is fine. So they can check 100 foods and rank how reactive you are, low, medium, or high. So good to be aware of. And if there are a large number of things you're reactive to, that's especially suspicious for not being long-term, for being fixable. And let's say you've got a large number of things that are significant, that are highly reactive. So the first step is you really do want to avoid those. So give yourself a nice block of 3 months of really just not having those foods on a regular basis, keeping them out as much as possible. And that will allow your immune system to stop making antibodies against them. And that will also help it to where you've got a better chance of repairing your intestinal tract. Along those same lines, it's nice to take steps to improve your flora. So stool cultures can show which good bacteria you have, which ones you might have too many, which ones might be lacking. And there's targeted ways in which you can improve that. If you don't know exact findings about your flora, I wouldn't take probiotics otherwise, because you might have too much just as likely as you could have too little. You can safely always do fermented foods, and there's so many great ones now available nowadays. Donna Gates, Summer Bach, a couple of really good friends of mine who are just experts in fermented foods, gut health, gut flora. Great resources to look at. Both have wonderful food products available, and you can always do fine with those. So get your flora really healthy and make sure that's just dialed in. There are things that are safe that also raise the resiliency of your intestinal barrier. The two best studied are glutamine and N-acetylglucosamine, so NAG or NAG. That's kind of funny. So glutamine and NAG. And they're safe, they raise the thickness of your gut lining, and they're great during that phase of really thorough avoidance. So 3-month block, totally off those reactive foods, and you're repairing your gut, making sense out of your flora. Afterwards, it's nice to recheck, repeat the data that showed you what you were reactive to in the first place. And I want to just hit one point again. If there's data from other tests, I would honestly ignore it. I've seen so many tests, some that are very costly, that have very wonderful reports, in which people have allergens that they don't if they run the same test again, even on a different day. So they're just not reproducible. So many labs will talk about allergens to common healthy foods, berries or greens or vegetables, and they really don't happen. They're so rare and so unusual. So if you've got a high number of reactions to unusual foods that are not the typical allergens, I wouldn't trust that data, and I would not justify your stress for avoiding those foods with the possible benefit of avoiding those foods. So stuff you were reactive to, recheck and see if things have changed. If you've seen a decrease in your scores, the next phase is reinoculation. You want to really have your body exposed to a variety of foods. And it doesn't take much. You can do small amounts. I'd also like to qualify that this is about healthy foods. So you don't need to re-expose yourself to Twinkies or Big Macs or like blizzards from Dairy Queen. I'm not talking about junk or crap or processed things, like actual healthy foods that your grandparents or great-grandparents could have eaten, that you could find somewhere on a farm. So foods in that category, the more you can eat, the better your flora will be, and the better your immune system will be. And the better nourished your body will be, the more nutrients you'll have. So of the ones you did not tolerate, add in just the tiniest amounts. You know, maybe it's a teaspoon a day for a few months. Maybe it's a tablespoon every few days, but intentionally add them back in and gradually allow your body to gain tolerance again. By all means, monitor your symptoms, and it's also good to consider rechecking maybe 6 months out to make sure you are seeing those decrease still. But reactions to many grains, beans and legumes, many nuts and seeds, not the anaphylactic ones, and also some versions of protein like eggs, they can really diminish for most people. They can really decrease. Dairy can be the trickiest, and also of the natural foods, dairy has probably the least amount of data saying that it's of health benefit for us. The one exception is probably some of the organic, non-fat, unsweetened Greek yogurts. You know, they've got some protein. They don't have living bacteria. They're pasteurized, but they have some good things from living bacteria. So they may have some use. That's like the borderline dairy. Otherwise, dairy, fine to avoid in general. But yeah, sugars, processed foods, preservatives, junk, that's not so much what we're talking about. We want to have you have a variety of good, healthy, simple foods and things that are minimally processed. So if you had a lot of restrictions, first, clearly identify what are your culprits, not based on short-term symptoms. Sometimes that can be misleading, but based upon good data. Avoid those foods, understand your flora, improve your flora, maybe take some steps to heal your gut lining. And when you've seen the reactions lower, start strategically reintroducing the foods. And really tiny amounts can go a long ways. After a few months of tolerating small amounts, they can take their place in a proper healthy diet. But food allergies, intolerances, sensitivities, many of them can reduce. And they can leave it to where you've got more food options. And that's only better for your peace of mind and your needs. So take great care, and we'll talk again soon.